So without further ado, it is my pleasure to introduce Dr. Yonas Ghebremichael-Weldeselassie. He is a lecturer of statistics at the School of Mathematics and Statistics at the Open University and a visiting senior research fellow at Warwick Medical School. He graduated in statistics and demographics from University of Asmara, Eritrea, and went on to become an assistant lecturer in Mekelle University in Ethiopia. He holds a Master's of Science in Biostatistics from Hasselt University in Belgium and PhD in Statistics from Open University. After working as a research associate on the MRC project titled Software Tools and Online Resources for the Self-Controlled Case Series Method and its extension at the Department of Mathematics and Statistics at the Open University in 2014, he joined Warwick Medical School in June 2017. His main research interest is in medical statistics, especially in the methodological development and application of the self-controlled case series method. Dr. Ghebremichael published a paper with Dr. Patty Farrington and Heather Whitaker. In addition to this, he is currently working on early prediction of gestational diabetes. With that, it is my pleasure to welcome you to our session today, and I'll turn it over to you.
Yeah, thanks everyone for coming. It's a great pleasure to be invited to talk in front of you. I will be talking about a small modification that we've done on the self-controlled case series method. We did it a couple of years ago in 2022. So relatively the method is new. It was developed by Paddy Farrington in 1995. So some of you might not be familiar with it, but most of you might be familiar with the method. So I will be starting with describing what the method is, how it works, and the assumptions that it uses, which is the limitations of the method, and the modification that we developed to the standard self-controlled case series or SCCS method while we were investigating the safety of COVID-19 vaccine in French data. I have no financial relationship to disclose. And to start with, this SCCS or self-controlled case series method is an alternative for the traditional study designs like the cohort study, case control study, etc. For example, in a cohort study, you follow individuals, and then out of those individuals, you see how many of them, you know the exposure status of those individuals, and you follow them for a time, and then see who develops the side effect or an adverse effect of the given exposure. Whereas the same thing in case control, you will have cases and controls. So you kind of compare individuals who are different from each other. Like you compare one person with the other, exposed with non-exposed, or you compare cases with controls, individuals with a side effect relative to individuals without any side effect of a given exposure. So to understand what a self-controlled case series method is, let's see these two questions. For example, if we have an exposure of MMR vaccine and we want to know what the risk of meningitis is in the 14 days following the vaccination. So in this case, we're kind of asked to find out what the absolute risk is. Out of a given number of individuals exposed, how many of them have the side effect, for example, meningitis. But there is a question, a similar but a different question, which could be asked in terms of investigating a safety of a given vaccine or any other exposure. For example, given that a child is vaccinated, a vaccinated child was diagnosed with meningitis, in the second year of life. So now we're given a condition that the individual is diagnosed with aseptic meningitis in the second year of life. So how more likely is that individual to be, how much more likely is that diagnosis arose in the first 14 days after vaccination rather than other time periods? So we have got some time periods where the exposure happens, that's immediately after the vaccination, and other time periods, it could be before or after the vaccination. Now we are trying to see, there's the first condition here, that given that the vaccinated child was diagnosed with aseptic meningitis, so we're given a condition, therefore, this relative risk, this question can only be answered if this condition is satisfied, which means the individual has the event of interest, in this case, meningitis. And that's why we call self-controlled case series method as a case series. The CS comes from this one because we are conditioning that an individual has the side effect or the adverse event of interest. I'll see why we call it self-control, but this is why we have the case CS in the case series study. Now, it's used to investigate the association between exposures like vaccines or any other exposures and their adverse events. And as I've already mentioned, we use only cases are required and no controls are required, as in the case of self-control. Case control study, for example, we need only cases. We need only individuals with the event of interest. The event of interest in this case is the adverse event of, for example, a vaccine. So we need the data from only individuals who had the adverse event. And the other feature of the self-control case series method is it automatically controls all fixed multiplicative confounders. For example, birth weight of a child. Birth weight of a child does not change over time. So it's automatically controlled in the analysis. So if you want to see the effect of, investigate the safety of a vaccine for a given adverse event, and sometimes you might want to control for sex, for example. So that is fixed, and therefore it will be automatically controlled, unlike in the cohort and case control methods in which you have to include in your model. But in the self-controlled case series method, fixed confounders are automatically controlled without taking them into consideration in your modeling. So it's a conditional cohort method, and we consider events to be random and exposures are considered to be fixed. We know the exposure status of individuals, and then the event times are random. And follow-up time is not censored at event time. Estimation is self-matched because we compare individuals within themselves. So what we compare is the time at which individuals are exposed relative to the time at which individuals are not exposed. And that's why it's called self-matched. The comparison is within individuals, and that's why it's called self-controlled AC, self-controlled case series method. Case series because it uses only individuals with an adverse event, and self-controlled because the comparison is within individuals, and hence all fixed confounders are controlled automatically. So this is how it works. For example, we have an individual A, an individual I. We start observing them at age A and continue observing them until age of BI. This is age at the start of the observation. age at the end of the observation. So at some point within this period of observation, the individual could be exposed to any exposure, say for example, a vaccine. So we determine the period at which there is a high risk of developing the adverse effect following the exposure. And we call this period, the red period, to be exposure period or risk period. And the period before the vaccine or the exposure is called control period, and the time period after the washout or after the end of this exposure period will be control period. So these two periods are control periods. So what we're trying to compare is what's the risk of having this event in this risk period relative to the other time periods. And therefore, this is a comparison of within an individual. So the individual observation period is divided into different categories, and some of them are controls and some of them are risk periods. So the data that you need in order to have a self-controlled case series method is, one is just the case, an ID it could be, and start of the observation period, that's AI, for example, individual one with meningitis had meningitis at 384 days of life. They were vaccinated at 516 days of life. And the end of the exposure is at 366 days. That's end of observation. So start of observation is 366 days from birth. End of observation 730. An event, which is the adverse event, occurred at 384. It could be somewhere here. And a vaccine, that's exposure, happened at 516 days of age. So this risk period can be defined. For example, for MMR, we've just asked a question, what would be the risk of having meningitis in the first 14 days? So from the vaccine to 14 days, this will be the risk period. So this is the data structure that you need in order to apply a self-controlled case series method. Start of observation, end of observation, the date at which exposure happened, and you define your risk period. And you have a date at which the adverse event happens. It could be in the control period where there is no risk, or it could happen in the risk period. So if you have many observations and if the events happen for most of them in this risk period, therefore your relative incidence of having the adverse event will be more than 1 as compared to the control period. So what we're saying is we're comparing individuals within themselves, therefore fixed variables like, for example, sex, like birth weight, or height of the child or the length of the child at birth. They're all fixed, they don't change. So we're comparing the times within the observation period. Since they are fixed, then they will automatically be controlled. But some of the variables, there are some variables which change with time. For example, age of the person. So the risk of developing the adverse event, it could be different at different ages. So the other confounders variables that change with time should be included in modeling the self-controlled case series method. The self-control is only for fixed variables that do not change over time. So in order to fit the or to have a model of self-controlled case series method, the first thing is to fix the observation period, where to start the observation and the observation periods. Then you obtain their exposure histories. When at the observation period did the exposures for each of the individuals happen, and then you subdivide the observation in two different groups. One is the exposure group. The risk periods could be more than one. An individual can be exposed more than once. So you can have multiple exposure periods. And if you want to include a temporal effect like age, you can subdivide the observation period in further classifications by age groups. So the observation period will be divided into risk periods and control periods and age groups. And you will have a likelihood function to estimate exponent of beta k. For example, here beta k represents exponent of beta k represents the relative risk of developing the adverse event relative to the control period. Nij is the number of events that happen, Nijk, number of events in a given interval for individual I. So we condition on the total number of events that happen to individuals, and hence we'll have this likelihood function, and this will erase the effect of individual effect, or fixed effects will be cancelled out within this likelihood function. So maximizing this likelihood will give us a relative incidence of developing adverse effect. So we can see if there is association between a given drug or vaccine or any other exposure with an adverse event. So individual effects will factor out so that we'll have a self-control. And we can use a Poisson regression to fit this model. And we have got an R package which does all this fitting. Just there is a simple function, standard SCCS. You input the start of the observation, end of observation, date of event, and date of exposure, start of exposure, and then end of exposure, and it will automatically estimate the relative risks related to the age groups and the exposures. So this is how we estimate parameters, or to see the association between exposures and adverse events. Now, in order for the self-control case series method to work, there are some assumptions that we have to follow. One of the assumptions is that events arise independently within an individual. We've said the observation period of an individual is divided into so many groups, so many intervals, and then within those intervals, a given individual can have multiple events. They can be diagnosed with the same event, with the same adverse event multiple times. But those events should be independent of each other. If an event happens now, it should not affect the probability or the chance of having another event with an individual. This is one of the assumptions. But this assumption doesn't always hold, because, for example, if we have an event or a side effect of stroke, so an individual who had experienced a stroke is highly likely to have another episode of stroke. So in this situation, this assumption might not be satisfied. And the other one is if the event within individuals are not repeated, if there is no recurrence of events, the side effect or the event should be rare or uncommon. Another assumption of the self-controlled case series method is that an event should not affect the subsequent period of the observation. We've said that we decide the observation period from AI to BI, age AI up to BI. But for example, if an event is death, if the side effect is death, then the observation period will be sunset. It won't continue until the planned end of observation, because we cannot continue observing a person who has died. Therefore, one of the assumptions of the SCCS is that the end of observation should not be affected by occurrence of the side effect. If the end of observation is censored by an event, therefore, we cannot use the standard way of analysis. There is a method which was developed to circumvent this problem if events affect the end of or the subsequent period of observation. Therefore, there is a modification which was developed recently. And another assumption of the self-controlled case series method is an event should not influence the timing of subsequent exposures. For example, we have exposures of, like, for example, a vaccine exposure, COVID-19 exposures. There were different doses which were given in the last few years. So if an event, a side effect happens now, and if it changes the chance or the probability of getting another dose of a vaccine, then this assumption is failing. So which means what we're saying is the chance or the probability of having an exposure should not be influenced by an event. For example, if a child is ill for a given adverse event, for example, in the early age, there are different vaccines which are given. If a child is ill, then they tend to delay the vaccine because of that adverse event. In such cases, so these assumptions fails. So what we're trying to say is that any adverse event should not affect the probability of getting an exposure, or the timing should not be affected by occurrence of an event. And the other one is exposures do not influence ascertainment of events. So for all these events, all these assumptions, failure of the assumptions can be dealt with using different modifications done to the standard self-controlled case series method. So there is an extension for the standard SCCS when the exposure of exposures are affected by an event. If an event delays an exposure or avoids it totally, then there is an extension to the standard SCCS method, which works by disregarding any events, any exposures which happen after an event. So, for example, we have multiple exposures for an individual. Then the event occurs after being exposed twice. Then the third exposure, the fourth exposure will be disregarded from the analysis and will be considered as missing. And there is the bias which could be, the model will be fitted using unbiased estimation equations. We use a pseudo likelihood rather than a likelihood to estimate the relative risks if event-dependent exposures are available in the given data. That's if events tend to dismiss, or if they tend to delay the exposures, we disregard all exposures that happen after an event, and then we estimate the relative risks. But in order to use this extension of the method, the risk periods must be known. For example, if an exposure, COVID vaccine is happening, and then the risk period should be known, say, for example, 14 days, 15 days, 28 or 30 days. It should not be indefinitely until the end of observation. So this is one of the assumptions in order to apply this extension of the standard SCCS method, where events, where exposures depend on event, or when events change the probability of being exposed in within the observation period. And we also have another extension to the standard SCCS method if the event of interest affects the subsequent observation period. If it censors the end of the observation period, then we have another extension that deals with such a data. Now let's see at the data that we have, which was the reason for developing a new method, or which led us to propose a new modification to the standard SCCS method. So the aim of the study was to estimate the relative incidence of stroke after vaccination with COVID-19 Pfizer-BioNTech vaccine. So in the data, we had 2,894 events of stroke, which occurred between December 15, 2020 and March 2021. We got this data from France. And out of this 2,894 events, 894 of them received at least one vaccine dose. And out of them, 407 had received both doses. There were 2 doses by then. And the median interval between those was 23 days. So the aim was to estimate the relative incidence of any cardiovascular events, but in this study, we focused only on hemorrhagic stroke that occurs after taking the COVID-19 vaccine. Now, these are the histogram of the event and the vaccine. So this is day 0 means December 15, 2020. And the last one is March 2021. So the observation periods for all individuals were from December 15, 2020 up to March 2021. And the vaccines were started at some point here after 20 days and so on. So some of them are here at the events occurred, some of them occurred before the vaccine was introduced, etc. So this is how the vaccines and the stroke days are distributed. And here we have got a histogram of events before the vaccines were given. So that's the distance between the vaccine and the event of interest. These were plotted to see if there is an effect of an event on the probability of getting vaccinated. So can you see here, there is a big dip before the vaccine was given. This is a distance between, that's events before dose 2, all the events which happened before dose 2. So there is a dip here. The number of events is really less before this dose. This shows that events are delaying the dose. Events are delaying the vaccines. Similarly here, events after dose 1, there is a dip here before 0 days from the vaccine. And this shows that immediately after the events, there are less vaccines, which means it's highly likely that events, the occurrence of a stroke is delaying getting vaccines, or it's avoiding them at all. Some of the patients who had stroke did not have the other dose, the second dose, and some of them had the second dose, but the dose was delayed. So it kind of shows us, it gives us a sign that there is an effect of events on the exposures. The probability of having a vaccine is being delayed due to the occurrence of the event of interest. The event of interest here is stroke. We're trying to see whether there is an adverse event, the association between a stroke and the COVID vaccine. But one of the assumptions of the self-controlled case series method is that events, in this case stroke, should not affect the subsequent exposures, the subsequent vaccines. But in this case, we have a dip here, less vaccines immediately before the dose. And it shows that there could be an effect of events on the vaccines. So a dip in the number of events just before each vaccine, and it shows that individuals who had a stroke are likely to delay or avoid vaccinations. And if there is effect of events on exposures, if events delay exposure or avoid exposure, then the relative incidence of a vaccine or any other exposure in terms of causing the adverse event is inflated upwards. So there is a way of correcting this failure in the assumption. So this is the assumption that should be satisfied in order to apply the self-controlled case series method. That's an event delaying exposure. But if the delay is only a short period of time, so once an individual has an event, then the subsequent exposures are delayed only a small interval of time, then a simple modification could help or could avoid the bias, which is inflation of the relative incidence. And this is done by including a risk period immediately before the risk period, which is pre-exposure period. So remember we had that line where we have AI, BI, and then the red risk period. So if you include another period, which is pre-exposure before that risk period, then this could avoid the bias which could happen due to event-dependent exposures. But if the delay is longer, if it's not a short delay, then we cannot use that one. So in our data set, what we did was we included different pre-vaccination periods from 0 up to 100. 0 pre-vaccination period means we don't have any, we just use a simple standard self-controlled case series method, and the effect of the vaccine in causing stroke is about 1.4 or something. And if we include a period of, say, 5 pre-vaccine period, then the relative risk changes. So as we change the risk period, the pre-exposure risk periods, then the relative risk of having a stroke following the vaccination changes. It goes from above 1, goes to protective down below 1. So this is a kind of a test whether the effect of the event on the exposure is short or long. If it is short, and we would have obtained a kind of a constant relative risk of developing a stroke in the 14 days following the vaccine. Whereas in this data set, we are observing a different story. The relative incidence changes with the change in the pre-vaccination periods. Therefore, we can conclude that the assumption of that the assumption that exposures do not depend on event fails. So we have to use the extension of the standard SCCS method, which handles that's where we eliminate or disregard exposures that happen after exposure, after risk period, after an event. So relative risk post-vaccination changes with the length of pre-vaccine risk periods, as we have seen it in this plot. Therefore, a method for event-dependent exposures should be used. We cannot use the standard SCCS method where the assumption is satisfied by including a pre-exposure risk period. That cannot be done here because having different pre-vaccine or pre-exposure periods is resulting in different relative risks. It's not robust to the choice of pre-vaccine or pre-exposure risk periods, and hence we have to use the modified SCCS that deals with event-dependent exposures. And another issue with the data is the data that we have. Now we have seen that events depend, exposures depend on event. A stroke delays further or subsequent vaccines. So this is one of the assumptions is failing. And the other observation in the data set that we had was 927 of the 2,894 cases. 2,894 cases means those who had stroke died after the event, relatively immediately after the event happens within the observation period. But some of them died. There are some others who died after the end of the observation period, which was March 2021. So the median time from the event, which is stroke, to death was 4 days for those who died within the observation period of 96 days between December 2020 and March 2021. So some of them who had a stroke died immediately after the event, and the median days between the event, which is a stroke, and death was 4 days for those who died within the observation period. But some of them died after the end of the observation period, that's post March 2021, and some of them obviously didn't die. So we had we plotted this one, the histograms, which tells days from event, the days of death, the date of death from an event. So this 0 is the day at which the event occurred, and these are the number of deaths. So events 41 to 60, we divide them into quartiles. So we can clearly see that most of the deaths are occurring immediately after stroke, which means the event of interest. Mind you, the first thing that we want to investigate is the safety of the COVID vaccine against stroke. Now, stroke is causing a death. If an individual is dying, then we cannot observe them until the end, until March 2021, which means the end of observation is being censored. So one of the assumptions is not fulfilled. And that's what's happening. So in this data set, we have got two assumptions which are not being satisfied. That's events are affecting exposures, they're delaying exposures, and events that stroke is censoring the end of observation. Therefore, two assumptions at the same time are failing. So we have methods when an exposure is affected by an event, we have a method to deal with it. And we have a separate model when the event of interest, stroke, censors the observation period or causes a death. We have a method to deal with that separately, but we don't have a method where two of the assumptions fail. here we have done an analysis to see if stroke is causing death. And we can see that the relative risk of dying after the score is 8.5 in the first 4 days, 3.44 in the first from 5 to 9 days, and there is no significant effect of the stroke on death after 15 days. So we can clearly see from this analysis that the event of interest, which is stroke, is causing a death. And causing a death means affecting the observation period, censoring the observation period. It's making us not to observe the individuals until the end of the planned observation period. So stroke induces high short-term mortality up to 14 days from this table. We have significant relative incidence of death following stroke. So death censored the observation period. Then we have got a model to address this problem. That's failure of the assumption that events should not affect the observation period. But here exposures are also influenced by the event. So two assumptions failing at the same time. So we need to have a new way of dealing with, and that's why we proposed a new model to modify the self-controlled case series method. So we see that when all the new method that we are proposing assumes that all the deaths are related to the event. So if there are deaths within the data, and we assume that these deaths are related to stroke, for example, and event-dependent exposures, the method which is used to circumvent the failure in the assumption that events are independent of exposure can be used. And we use, instead of using the date of death as the end of observation, the modification that we did was we use the planned date of observation. And if deaths due to the event of interest have no impact in the estimation process because they would not affect the exposure. If the event does not happen, then the death couldn't happen. So in practice, what we do is use the extension of the standard model by setting the end of observation as planned end of observation without changing them to the date of death. If we know that there is a high mortality due to the event of interest. And if we do not have any knowledge that the high mortality is caused by the event, then we should use the earliest of the date of death or planned end of observation. And if we know the cause of the death for all of the individuals, then for those who died because of the event, we'll use their observation period to be the planned observation period. And for the others, we use the date of death. So this is the proposed model. And we have fitted to the model. We've got model 1 here and model 2. Model 1 is where we set all observation periods, including the ones who died not because of the event, to be the planned end of observation, which is March 2021. And in model 2, we decided to end the observation period at the planned observation period for those who died after 15 days of the event, I mean before 15 days of the event. And for those who died after 15 days of the event, we decided the end of observation to be at the date of death, because we have seen that stroke does not cause the death after 15 days from the analysis that we did previously. So, and here is the sensitivity analysis that we've done by different values of D. That's to set where to set to decide whether deaths are caused by event or not. If it is 0, which means we are saying that all of them are not caused by the event. And then we're saying here 40, for example, we're saying up to 40 days after the event, all the deaths are caused by the event, and hence we end the observation at a planned end of observation, which is March 2021. And we can see that the relative incidences are constant after these ones, which is kind of expected. And we've done some simulation studies to see whether our proposed model is robust to the assumption that we say that we assume that all the deaths happening are related to the event of interest. So if the proportion of deaths happening none of them are, all of them are due to the event, then this is the bias. And to the extreme case, if we say that 30% of them were not due to the event, and the bias we get, for example, if the relative incidence of 2 is given the relative risk of having a stroke following a vaccine is 2, then the bias will be like 0.02, which is about, it will be exponent of 2 and so on. So it will be 1.96. So it's not even too bad if we have a worst case of like 30% of them are not due to the event. And so we showed that our proposed method, by using the event-dependent exposures model and assuming that all the deaths within the dataset are due to the event, is robust to the failure of the assumption. And if you want to read more about the self-controlled case series method, you can have a look at the book we published in 2018 with Heather and Paddy, and we have developed an R package called SCCS package, self-controlled case series method package, which is accessible from CRAN. And there are more references here. And thank you for your attention. If you have any questions, please.
Thank you so much for that presentation. It's very insightful. You've given us quite a lot to think about. I'm going to go over to our Q&A section. First question. It says, can you clarify so I believe this was from very early on in your presentation. It says, can you clarify what is meant by controls all fixed multiplicative confounders? What do you mean by fixed? And what does it mean to be multiplicative?
Yeah, so when we say fixed, when we do the self-controlled case series analysis, we observe individuals through time. So for example, in the picture that I had in the early slides here, so we follow them from age A up to age B for individual I. So when we say fixed confounders, means confounders which do not change over time. Any attributes of the individual that do not change. For example, the birth weight of a person. The birth weight of a person is always the same throughout the observation period. So we don't need to include the birth weight of a person into the model when we try to estimate. So it's fixed. But there are some variables which change through time. For example, season. So the effect of having the event following the exposure could be different in different seasons. So we have to take into consideration age, for example, people grow, so the age changes within this observation. It doesn't stay fixed. So we have to take it into consideration when we model. Whereas fixed cover rates, fixed confounders, which do not change through time, should be are automatically controlled, whether they are measured or unmeasured. We don't need to worry about them. I hope that answers the question.
Thank you. Our next question is from Joanne Gerber. She says, thanks for this great presentation. And with a single dose vaccine, it is possible to address the issue of event-dependent exposures by excluding all pre-vaccination time and using SCCS model for the high event-related mortality. Could you discuss your thoughts on the relative advantages and disadvantages of that approach versus using this modified SCCS model?
Yes. So if the effect of the event on the exposure is short, then if you include a pre-exposure, that will be okay. You can use the standard model without worrying about using the modified, because you will have a consistent relative incidence. But if the effect of event is stays long, like for example, it can avoid the vaccine at all, or individuals might decide not to be vaccinated at all after having an event. So in such a case, including pre-exposure will give us biased results. So we have to use the modified. The modified obviously would be a better method to use. So it depends on whether the effect of events in pushing or delaying the exposure is short or long. If it is short, then I think we should get similar results whether we use the new method or we use the pre-exposure models. So we can actually use the new one. I presume we will get the same results with the other modifier, which is including a pre-exposure model and fitting the standard SCCS model. But the difference is just in terms of complexity. If the effect of events on exposure is only short, but we have the software already developed, so it won't be any problem. We can use either of them. The results, I don't think, will be any different.
Thank you for that. Our next question comes from Patrick. He says, you discussed the SCCS modeling assumptions, and I'm sorry, also thank you for your presentation. He says that you discussed the SCCS modeling assumptions and the examples where the assumptions were violated. Do you have specific guidance for the community about what we can observe as an objective diagnostic that we could use as a go, no go criteria to determine if SCCS results should be blinded, because we shouldn't have confidence in the validity of the results?
Yes, we published a paper in around 2017 where you have different ways of testing whether the assumptions are satisfied or not. And partly we have done it here in the examples by having the plots of the histograms, the distance between the event and the exposure, etc. And then fitting pre-exposure and trying to see whether the relative risks change with, are they sensitive to change the pre-exposure periods, etc. And then you can also use whether the assumption that events are independent, I mean, observation periods are independent of the events by fitting a model, for example, the event as exposure and the death as an event. And we have seen it, for example, in here, that the event of interest was struck, and we want to see whether the vaccine is safe in causing stroke. And we want to see whether the event of interest, which is stroke, affects the observation period. So what we did was we considered stroke to be as an exposure and death to be as an event. And we have seen that there is a significant effect of stroke on death, which means the assumption is being violated. And hence we have to use the modified SCCS. So there is a paper, I'm not sure if I have included it in the reference. Oops. That talks about testing the assumptions of the self-controlled case series method. I haven't included it, but I can send the reference. So we have ways of testing the assumptions, whether the assumptions are satisfied or not. And we can decide which methods to use, whether to use the standard SCCS or the modified versions of the SCCS.